Hello and welcome to today's webinar. Over to your host, Clenton.
Welcome everyone. We're pleased to see so many people on this webinar. As Chair of Think Local at Personal, or TLAP for short, I'm proud to share our work on personalised care and support for and with people from Black and Asian and ethnic minority communities. This work started early in COVID pandemic when the disproportionate impact on people from ethnic minority communities became clear. At TLAP, we make it our job to point out when things aren't right, but we also contribute to the solutions. To be honest, when we started this project, we weren't sure what we would find. I'm pleased to say there's plenty to report. First, a couple of housekeeping things. Please use the question box for your questions. We will aim to answer as many as we can during the session. We are recording the session and it will be up on our website in a week or two. If you want to tweet during the webinar, we are using the hashtag TLAP webinar. In a moment, we'll hear insights from David Truswell, who did the bulk of the work on the report with a colleague. Then we're going to hear from 3 organisations who featured in the report. First, Browne from Nubian Life. Second, Nichola Lauder from Irie Mind. And finally, Mercier at Doncaster Council. They have kindly agreed to talk to us whilst I make sure they keep to time. And from today's session, I hope you will take away some of the broader issues highlighted in our report. Many of the organisations act as a bridge between communities and the formal care and health system, but not fully connected. We think there are other organisations up and down the country doing similar work, but are hidden in plain sight. The challenge and opportunity is to make them more visible and for the system to work with them as equal partners. Now we're going to start with David, and what would you like to share with us, David? Thank you.
Thanks very much for that, Clenton. Really, I'm going to give a brief overview of the interviews conducted by myself and my colleague Melanie Phillips to collaborate on developing the report. One of the things that came across quite strongly to us as we did the interviews was finding out that there's a lot of commonalities between the different organisations that were responding and are all mentioned in more detail in the report itself. So what I'm going to do very, very briefly is illustrate what seemed to us those main commonalities, which were really a kind of can-do spirit in relation to all the challenges that were being faced by the organisations in the period of the report itself, and continue to be part of the landscape for those organisations. Also, for the focus for all the organisations on having a creative response to these challenges, and that creativity was focused on not just the needs but also the aspirations of the folk that they were supporting. And also, I think a third overarching issue that came across in all the interviews was the commitment to creating an individual personal relationship with the people being supported. So they're very much not just a a number or a box to be ticked, but it was always about developing a particular relationship with particular individuals in order to enable them to meet their aspirations. I'm sure everybody who's speaking here today will give examples of all those three elements and other elements that contribute to them being really exceptional in delivering personalised care to Black, Asian and minority ethnic communities. I think key challenges such as the financial constraints and also over the last couple of years, the COVID challenges were very much part of what organisations have been struggling with over the past couple of years, and really all the organisations speaking today, the other organisations mentioned in the report, are always faced with financial challenges as a consequence really of general economic situation, but also I think that the lack of investment in social care services. I think what's really important coming out of listening to the interviews is the way in which people are using their human capital and their human qualities in responding to people as individuals in order to find the way that doesn't just simply meet people's needs, but also helps to inspire them about the value of relationships generally, and also feel that their whole life is being improved by the contact with the particular services involved. What's important in the organisations who are speaking today is to be able to understand that the response, they're all different scale organisations. So Nubian Life is very much an independent organisation offering its services and its resources. Irie Mind is part of the collaboration with the services that are part of Hackney Mind in the city and Waltham Forest. And then you've also got Doncaster Council, which is really, I think, an excellent example of an institutional level response to the challenges of supporting people from minority communities with their health issues. So there's a lot to learn from what people are going to say today, and also from the report in general. And I think it's important for folk who are listening to appreciate that, you know, we're not just talking about what do the problems look like, but in the spirit of the report's title, it's about closing the gap. This is about what solutions look like, and solutions that work well for people who need support services. So without any further ado, I'll hand back to Clenton so he can introduce the rest of the speakers for this session.
Thank you very much, David, for that. Sanchi, before we start, Sanchi, have we got any interesting comments so far from people?
Yes, there's stuff coming in, so please put your questions in the question box. A couple of people are having connection issues, but we will be putting the webinar up on our website later. So if you have got problems, there will be another opportunity to see it. Thanks.
Thank you for that, Sanchi. Now we're going to hear from Jazz Browne, Chief Executive of Nubian Life in West London. Over to you, Jazz. Thank you.
Thank you, Clenton, and thank you for the TLAP team for giving me the opportunity to briefly speak about the work of Nubian Life, and particularly our next of kin service. Nubian Life is a second generation organisation. It was set up by a group of African Caribbean older people back in the 80s when they realised that they weren't going to go back home as planned. When they originally arrived in the UK, they weren't being welcomed by mainstream services, and as a group they decided to set up their own service, and they became Hammersmith and Fulham Black senior citizens. And that later on developed, you know, from a social club into a luncheon club, and then fully into a daycare service. And that's when Nubian Life was originally registered as a charity and an entity. Out of the experience of our clients attending the centre, the Next of Kin advocacy service was birthed, really. It wasn't something that was on our minds, but we began to see the challenges that our clients were facing in terms of accessing services, but also the practical support that they needed to be able to complete services. For example, we had a new client attend the centre, and he turned up in a wheelchair with a plastic bag full of letters. And the first thing he said to us was that social services told us that we would help him. And as I went through his letters, he was living in temporary accommodation and had been offered a flat, an unfurnished property, and he had about 10 days to move into that property, but no furniture. And so that began the practical support in terms of, we began to liaise with the housing, with social services, we purchased the furniture, we organised his move, and we got him into the property. And it really, the Next of Kin service just came out of that, in responding to the actual needs of older people at a point when other statutory services stopped their engagement with them. And so that has been our work from that period onwards. There are 3 strands to the Next of Kin service. Firstly, we provide general advocacy, support, advice and information, and that's UK-wide and sometimes international. We quite often receive phone calls asking how people can take care of their parents in the UK whilst they're abroad. But the main area of our work is that practical advocacy. It's how do we support people to attend their hospital appointments? How do we ensure that they understand what's been offered to them? How do they make informed decisions about their care? How do they make informed decisions about their finances? Anything where they don't have a relative, or sometimes, you know, in the case of older people who don't wish their families to be involved due to breakdown in family relationships. And so it's a really key area of support that we provide that isn't provided by social services and other agencies. We provide a range of personal support to older people, and that's where we help them to manage things like their power of attorney, their direct payments, and anything, funeral arrangements, anything that's really personal to them where they need the support. I've had the privilege, it's a weird thing to say, but I've had the privilege of burying, you know, some of our clients because they haven't had anyone else to do that for them. And so the fact that they've trusted us as an organisation to carry out those really important roles for them is something that, you know, we feel honoured to be able to do. But again, it highlights the gaps as to where the intervention from social services stops, and then there's nobody else to perform those roles for them. And so I think one of the things that I can talk about is the challenges, you know, of providing such a personalised service is that it's resource intensive. You know, it sits out of the framework of traditional advocacy services, and therefore it's very hard to fundraise for this particular type of work. And so it requires a personal commitment to the work that needs to be done. It requires a personal commitment to older people and the issues that they're facing. So it really isn't a 9 to 5. The advocacy service is a 24-hour call-out service, and that's normally myself. So if somebody gets admitted to hospital, I go to A&E and I sit with them and take them through that process. If they go into hospital, we go into hospital with them and we ensure that they understand what's happening. We make sure that they have culturally specific food, as quite often, you know, that's an issue for older people, is their nutrition. You know, they tend to go downhill quite rapidly in hospital. And so just providing that community connect, we've found to be really important. The things that we're really proud of around the Next of Kin service is that it really is personal. You know, there's no other way to describe the service. It's, you know, it's definitely not a one size fits all. It's based on that individual. It's about their journey, you know, until the end of that matter being resolved. The benefits of not being funded means that we can really respond without boundaries. And I think that's something that we're really proud of as a provider. So I just want to, you know, say thank you for this opportunity, because to talk about the work, because the benefits to older people are unmeasurable, really, to, you know, just knowing that you've met that person at their point of need and you've delivered or you've supported them to achieve the goals that they desire. So thank you.
Thank you very much for that, Jazz. Very interesting points you've made. Sanchi, is there any other comments coming through?
Yeah, lots of positive comments about Nubian life and questions. Jazz, you might want to answer very quickly whether you're based in other London boroughs apart from Hammersmith and Fulham, or nationwide. So that was just a quick practical question. And other questions coming in, I think we can manage at the end.
Right, as a daycare provider, we're based in Hammersmith and Fulham. The advocacy service is UK-wide, so we try and help, and if we're not able to help, then we will refer on to another organisation or agency, but we will follow that referral through.
Thank you.
Thank you.
Thank you very much for that, Jazz. Okay, if we go to the next speaker, which is Nichola Lauder, from Director of Irie Mind in Hackney. Over to you, Nichola, and welcome.
Okay, so good afternoon, everyone. And as Clenton said, my name is Nichola, I'm the Director of Irie Mind, a Black, African and Caribbean mental health and wellbeing service. Before I start, is anyone familiar with the word Irie? I suspect many of you may have heard the word before. It's a word originally from the Caribbean, in particular, especially Jamaica. And it's something that means, you know, there's no problem, there's positivity. It's a friendly, warm greeting. And except we use it, for us, it's an acronym that stands for I is for integration, R is for respect. We think it's really important that those coming through the door are respected, especially so many people are not, especially from other services. Inclusion and empowerment. We recognize that many of our clients do already have gifts, but it's about empowering them to use those gifts. So this is a name that came up a few years ago from our clients. So to all our clients, we want to say Irie. So who are we as a service? So as I said, Irie Mind is mental health. If we can go into the next slide, thank you. So Irie Mind is a mental health initiative for the Black, African and Caribbean communities. We work across the City of London, Hackney and Waltham Forest. As it says on the slide, we are a comprehensive and holistic wellbeing centre, and we target the marginalised, at risk and disengaged clients within Hackney, Waltham Forest and the City, and in particular the African and Caribbean communities. But also, you know, we're a bit more than that. You know, we are a Black-led service, and that is to reflect the culture and the know-how of the individuals that we serve. We promote and champion positive Black mental health, and we provide community-based solutions to mental ill health. What we recognise, it's really important to get the community involved in what we're delivering and making sure that they're part of everything that we put together. We're very much about addressing stigma and myths surrounding mental health within the Black community. We're also about increasing access to culturally specific interventions, including psychological therapies. We also have a number of psychosocial groups such as Nyam and Go, which is about cooking traditional African and Caribbean dishes, but in a healthier way. So we might replace sugar with dates, milk with milk made from oats or rice, almonds, those kind of things. We do a lot of reducing our salt intake. We also got a young women's group called This Gal Can, and that's really about promoting one's self-esteem and really empowering our young women to become the best version of themselves. We also have a counselling service called TARCOP. We also have Couch Time, which is where people can come together and talk about those day-to-day events and situations that plague them. And we've recently launched a group, an acceptance and commitment therapy group for racial trauma. And finally, we like to give our people a sense of purpose and hope. One of the things we often say to our clients, you are made on purpose for a purpose. And this goes a long way just for encouraging people and just instilling those seeds of hope. And our motto as a tiny service is to boldly go where no man has gone before. Yes, and that comes with its challenges. We are a small service and we're also only 2 years old. And one of the challenges that we certainly have experienced over the last couple of years, and we launched just before the pandemic, is that there is an increased demand for cultural specific services, okay? Which, yes, in some regard is fantastic, but that comes with its challenges itself. So we launched in 2019. And certainly since the pandemic, we've seen a phenomenal increase in the number of Black, African and Caribbean clients accessing counselling or requesting counselling. And this is something for years, a number of, commission services said, we need to get more Black people accessing services. Well, trust me, if there's any commissioners online, they are accessing services, which is excellent. Okay?
The camera's not on.
Okay. Especially culture, and it's a great space for people to speak about some of the challenges that they're experiencing.
I'm on now.
But with that, with the increase in demand for culture-specific services, what we are finding that there's insufficient skills to match the complex needs that are currently being provided or being presented. So we're finding that we're having to skill up our staff who are fantastic in what they do, but the current tools that are available, interventions that are available in the market, are just not sufficient to meet the needs and also the presentations that are coming through. So we're always looking for ways to redesign or to adapt some of the kind of Western culture, Western interventions at the moment, but also creating new ones as we continue with our service. And then finally, similar to what Jazz said, and Jazz, what a fantastic service, and thank you for sharing all that you're doing there. And sustainability. So we're always looking for possible ways in which mental health systems and professionals can engage across cultures more equitably, but also sustainably as well. And funding is always going to be a challenge for small organizations, small charities such as ourselves. But what has been a positive for us when it's come to working across other services is looking at the value-added service that Black, African and Caribbean voluntary sector organizations can bring. And so certainly we've worked alongside our statutory services partner, which has worked really, really well. And, I'm looking at the ways in which we can bring new forms of knowledge and ways of working with clients into commission health services. So where there's normally a gap, one of the things that we've been able to do over the last year or so is to think about bridging the gap between the voluntary sector, but also with the statutory services. Okay. And one of the things, if we do have the statutory services on there, one of the things I would ask is that statutory services continue to trust us as smaller organizations from the voluntary sector, trust us, trust us, but also have a flexibility, for allowing us the scope to innovate together and alongside other commissioned services. Because this is will be a benefit to the outcomes for our clients and improve our services and learning for the entire sector. And because we have been doing a lot more work with our statutory partners, one of the things that we're really proud of as a small service is that we were recently awarded the Health Service Journal award for Mental Health Service Redesign Initiative based on the development of a culturally focused IAP, being improving access to psychological therapies for communities by the communities. And this was in conjunction with the City and Hackney ICP, North East London Clinical Commissioning Group, and a number of our Turkish and Jewish organisations within Hackney, and we have been awarded this award in September, and we're really, really proud of that. Steve, can I ask you to go to the last slide, please? But more importantly, I'm really pleased with the progression of our clients, especially during these difficult times. And here you'll see some of the slides from our clients, and these are some of the services. One again, back again.
Is that right? Is that right?
That's the one, that's the gallery on, yeah, absolutely. And, you know, these are some of the, you know, so just over a year ago, we met with celebrity chef Isaac Carew, and he works alongside our Nyam and Go group. We had a number of Zoom sessions going on during the pandemic where we had loads of people coming out just to talk about how, you know, the pandemic's impacted them, but also having that space to share how they're coping or may not be coping, but also having that space to support each other and having that camaraderie. We had a number of pampering sessions which we've reintroduced, so clients come in, they get their feet done, you know, they do their pedicures, their manicures, you know, they might be playing dominoes, but just giving people that safe space to be able to become themselves again during what has been a very, very, very difficult time. And I believe I have, is Helena on? I think Helena's on. Yes, she is on. Helena, can you hear us?
Yes, I can. Hello,
okay, brilliant. So Helena, thank you so much for joining us. Can you just share with our audience and also with the panel how, you know, what you're doing at Irie Mind and how that's helped you, especially during these challenging times?
Okay. Hello, everyone. I apologize for yesterday. And my name is Helena Charles. I am a member of our lovely Irie family. I unfortunately attend by virtually owing to the pandemic at present. Nonetheless, I have support from the Irie, which I'm always grateful for meeting with my fellow members and being on my own here all day. I do get support. I've got the challenge of hoarding. Nonetheless, we've got visual boards which help, and I've gained my confidence by being present at the Irie. As a matter of fact, I look forward to the 2 days of the week when we meet. We've got one session which we call On the Couch, where we've got various speakers. We speak about various things, like, for instance, challenges in our lives. We've got both men and women, but we also talk about things like vision. We've had like a speaker from the opticians this week, so we were able to talk about other things like cataracts and other things, and we all contribute. And I feel grateful that the staff treat us all. We all seem, there's no problem that's too much for to be dealt with. And I am very proud of Irie. And as I repeat myself, Irie is invaluable to me, particularly at this time now where I'm isolating, because I only go outside for walking, nothing more. So once I see Nicola's face on a Friday morning, that's it. I'm happy.
Thank you so much, Helena. So Helena comes along to our Melanin Rich Women's group, which meet on a Friday. And she's very instrumental in that group and very encouraging to the other women, especially some of the younger women in the group. And so I just want to end it there for now, but I just want to say thank you for everyone, and thank you so much for joining us today. And thank you so much, TLAP, for recognising the work that not just Irie Mind are doing, but so many organisations across the country. Thank you.
Thank you, Nichola and Helena. Great to hear what's happening at Nubian Life. So we'll get in a bit short of time. So I know there's lots of questions coming in. So we'll move straight on to Tasha Mercier. And Tasha is going to talk about the COVID, and is a COVID community link worker with Doncaster Council. Over to you, Tasha. Thank you.
Thank you. Thank you very much, Clenton. Okay, so you can all see my infographic. So I'm just going to add a little bit of context first of all. So in 2018, we conducted a BAME, quite a dated term, but this was 2018, health needs assessment in Doncaster, which provided us with a set of actions and recommendations to improve health in ethnic minorities within the borough. Fast forward to 2020, obviously we find ourselves in a pandemic, and local authorities were assigned resources to support those most at risk of suffering health inequalities. A BAME COVID action plan was then developed. What you see before you is an infographic of said action plan and some of our achievements to date. So I'm just going to talk through some of the things that we're proud of, some of the pinch points that we've come up across, and then a takeaway point. So one of the big things that we are really proud of as a team is that we have vaccinated over 5,000 people by going into communities and bringing the vaccination programme to them. So during clinics, we would have things such as translators on hand and COVID information in a variety of languages, suitably qualified staff to be able to answer any questions that anybody had. We've also worked really closely with faith and community leaders as trusted key figures to increase vaccination uptake. So in terms of barriers, probably not surprisingly, trust is a big one. Ethnic minority groups across our borough report that historically they have felt done to and not consulted with. Data is also a huge pinch point, as ethnicity data on a local, regional and national level is often inconsistent, non-existent, or contains huge gaps. So in terms of a takeaway message, I think we often refer to our ethnic minority groups as hard to reach, which I believe simply not to be true. We absolutely know where these people are. I think as public sector organisations, we need to adapt our approaches, build trust and go out into these communities. And we need to move away from the idea that ethnic minority groups are hard to reach and towards the idea that we are underserved. Thank you very much.
Thank you very much for that, Tash, and I'd like to thank all four of you for an interesting contribution to our discussion. Now we're moving to the question session with the remaining time, and Sanchi's going to read out some of the questions for us.
Thank you, Clenton. Yeah, we're getting a lot of questions in, and firstly a lot of positive comments about what everybody shared, so thank you very much for all that, and particularly thanks to Helena for people have enjoyed hearing her story, so thank you for your contribution, Helena. A specific question probably for Nichola. Can you remind us what Irie stands for? How is it funded? And a question about the culturally specific IAPT that you mentioned. How was this commissioned, or how did you get it into the commissioning process? So sorry to ask you loads of questions in one go.
That's okay. Let's start with the first one. So Irie itself stands for integration. So it's about integrating our communities, respect, inclusion and empowerment. Okay, and Irie, the word itself means no problem, everything's okay. Okay, written from the Caribbean. What was the next question?
How's it funded? funding.
Okay, so we're funded by grants. We get small grants. Now, one of the challenges with the grants we get, they're very short-term grants. So we've got lots of grants during the pandemic to address the issues around the BAME community, anything around finances, anything around racial discrimination, but small pots of money and short-term funding. They're mainly grants, and we do have funding from one of our main statutory providers, CCG, and that leads us nicely into the IAPT question. So Mind in the City Hackney Waltham Forest, which is the umbrella that we sit under, they've been an IAPT provider for the last 6 years. And we recognise in an organisation that we had a small group of clients that weren't accessing the IAPT service, i.e. namely the Black, African and Caribbean clients. And so what we did, we went to the commissioners and said, well, look, you know, we have Irie Mind client, we have an Irie Mind service, which is our cultural specific service, where we can provide a wraparound service. And because it is a wraparound service, we can encourage our clients to access therapy whilst building, almost like becoming a bridge or a conduit between the statutory services and Irie Mind, and kind of working alongside our clients, also understanding what the clients required and what they were looking for. So we developed acceptance and commitment therapy, which is a third wave CBT intervention. So for those of you who aren't familiar with the IAPT service, it is mainly it's a CBT service, and it's based on we do step 2, which is working with clients with mild to moderate presentations of anxiety and depression, and then you have step 3, which is working with clients with more severe moderate presentations of anxiety and depression. And so what we'll find is that our clients weren't responding as well to the pure CBT model, not as well as we'd like. So everything's based on recovery rates. So recovery rates weren't as high as they could be. But what we've noticed in other parts of our service, we were using acceptance and commitment therapy, which worked really, really well with our clients. So we had a number of meetings with the commissioners saying, you know, we can use this because it is similar to CBT, it's part of the CBT family. But how we've made it more cultural is we're using the language that our clients will be comfortable with. So certainly within the African and Caribbean services, communities, looking at the language we use, and also looking at values. Values are very important and an integral part of this community. So an acceptance and commitment therapy is heavily based around values. So it's helping our clients to get back to those things that are going to help them achieve their goals. And so the cultural element was looking at those examples, looking at things that met the needs of our clients specifically, but also the staff delivering them were also from the African and Caribbean communities, all therapists trained to that level. So that's part of our IAPT intervention, and that's what makes it culturally specific. It's also delivered within the community more so than within a statutory service environment. I hope that answers your question.
Thank you very much. There's lots of questions coming in. One for Tasha and others. Tasha mentioned that BAME is a dated term. What do you think are the problems with this terminology, and what might be a better alternative?
So we've had quite a lot of feedback in terms of that phrase, definitely on a local level, and that it doesn't necessarily feel representative. We've definitely moved towards using ethnic minorities, which doesn't actually, that probably feels a bit lackluster, but I do feel that it's better than BAME. I don't know what others think.
I've not yet heard anybody suggest a useful alternative.
For me, it's when we have to think about the context. Most people use the short term, and when I talk about Black and Asian minority ethnic communities, I spell it out, and that's you know, and like David says, there's not an alternative to it at the moment, but we need a conversation as individuals and communities to see how we might reframe and name what we're talking about.
Yeah, and I think while just being cognizant of the fact that from the conversations that I've heard and from the different things that I've read, really difficult to please everybody on that front. Not easy, not an easy job.
And Natasha, I agree totally. I think that's why within our service we say Black, African and Caribbean, because people say, well, no, I don't want Caribbean, I want Black. And it's very difficult to please people. It really is. But I think it's important that we put it on the agenda.
Absolutely, I agree.
And have the conversations, certainly.
So similar but slightly different question. I'm interested to know more about how we can support care homes to provide culturally sensitive services to members of these communities. What support can be provided with people with a faith in such settings? Clenton, I don't know who you want to direct that one to.
David, any thoughts on that?
$64,000 question. I think, well, there's some work that actually now Dr. Karen Jutler over in Wolverhampton, who's just back from maternity leave, has been working with care homes specifically around engaging with the South Asian community in that locality. And one of the things that I believe is quite important is that care homes engage with the fabric of their communities, and there will be different diverse communities in the locality of all care homes. And I think in the spirit of the kind of approach that organisations have taken who've been speaking today, it's about what is the individual solution going to look like for each person. So I don't think there's a blanket kind of, this is how to do a South Asian care home, or this is how to do a Chinese care home. It's about how do services in the context of being a care home, how do they figure out how they're going to work with some of the individual cultural issues as they're expressed by the people who would like to be supported by their services. It's not easy. It's a tricky, complex challenge. And I think that organisations need to work with community groups in their locality to figure out how they respond to that challenge. And that also includes commissioning organisations as well.
Jazz, any thoughts?
My thoughts is that care homes remain an ongoing challenge. In terms of, you know, when we start talking about person-centered care, is that the minute somebody enters into your doors, you're looking at that individual, and what we should be looking at is what all of their needs are. And so we shouldn't get to a point where people's needs have been unmet just based on their culture. You know, because that's the very point of assessments, that's the very point of providing care, you know, within a care home. And also this systematic way that older people are often disengaged or disconnected from their communities when they go into care homes. And so care homes need to be a little bit more open and receptive to working with local community groups. But also the issue around commissioning is that when somebody goes into care, their lives don't stop. Everything that they've been connected to beyond their family doesn't stop, and that should also be encouraged and engaged with within care homes. And this is one of the issues that we faced through the advocacy project. You know, in 2018, I was told by a care home that we cannot meet the needs of, you know, ethnic minority people, but we're in 2018. You know, why is that the case? Why, as a national provider for care homes, are you unable to meet, you know, people's needs? And so I think it's something that needs to be, you know, really looked at, you know, because we're providing care, and that care is supposed to be personal.
Thank you, Jazz. Helena, your thoughts on that question? Be interested.
I'm listening to what Jazz has stated. Yes, we are in an environment, but we've got to look at even among us, we come from diverse backgrounds, different islands, different what have you, but it's also the person as a whole. So it's how we care for our skins, how we care for our hair, it's everything else. So the whole thoughts are whether or not the care home has got the staff to look at, how I would comb my hair, how I would grease my skin or what have you. So these things are, so it's a blanket. It doesn't come under like an umbrella that the trust can say, yes, we can do so and so, because we might have somebody who doesn't know the first thing about your skin or my skin, or what we eat or what we would digest. So there's a lot to be dissected. I mean, I don't know how you see it, but that's how I look at it.
Thank you for that, Helena. Nichola, are you trying to come in on that?
I wasn't, but I'm going to. I'm going to. No, because I think I agree with everything that's been said, and I think, because my thing is, and I think one of the things that's worked with us, you can't do everything. So I think it's about identifying those organisations that can work with our communities, and giving our communities the opportunity to do that. Okay, but a lot of the time the answers are there, and I think too often we're trying to be all things to all people, and actually I think that's really difficult to do because someone's going to suffer. And speaking to my clients, often it's them. So I think if we can create more services that deal with more culture-specific services that can do this, but also when you create them, make sure they're sustainable, because they come up for 1 or 2 years and then before you know it, they're gone. So there's something around, we can do this, but you have to put your money where your mouth is, and you have to really step up and do it. Yeah, you can't expect this XYZ service to do, because a lot of the time these are cultural things. And yes, you can teach people the culture, but actually we had the conversation this morning with our client. It's so much easier when someone just knows. You do your assessment, you know it's instantly what's expected. You say, yes, I can provide this. And if you do not know if you can't provide it, find somebody that can. Certainly. There's lots of gaps that need filling. We're getting better at filling the gaps, don't get me wrong, but there's still gaps that need to be filled.
Thank you, Nichola. Sanchi, is there any more questions coming through?
There are so many I can't keep up, but one thing I think we should address is there's been a couple of questions about why we haven't had any presentations from people from Asian networks or communities. I would say that the report that this webinar is based on, we spoke to 14 different organisations from a wide variety, including Chinese and Asian. This just happens to be our webinar panel, but there was no intention mentioned by that. But I wondered if any of the panelists would like to comment on any services that they provide, or whether they're asked to provide for Asian communities.
Nichola, any comments?
Yeah, sure. So, because we do work for Mind in the City Hackney Waltham Forest, we do have referrals coming through, but I often will refer clients to our local, so we do have a Chinese community centre, we also have a youth Vietnamese community within Hackney that we will actually refer clients to those more culturally specific services. We have done work in the past with the Vietnamese community, especially around food. There's a group called Recipes of Life. So we have done things with those guys before, but there's a lot of cultural specific services within Hackney, most certainly, that are doing some great work as well. And actually, I don't know who asked the question, but that was one of my questions originally as well on the panel.
Thank you for that. Tash, your thoughts?
Yeah, I mean, I suppose it's a little bit different in terms of a lot of you guys sort of have support services, and I'm coming from a slightly different angle, but thinking about the work that we've done with the Asian community across the borough, thinking about COVID specifically, we've gone to the local mosques, the local Gurdwara, worked really closely with those faith leaders, and set up vaccination clinics, basically. So we've gone onto their trusted territory and with our vaccinators, and there's been an opportunity for people to come and ask us questions. Again, we've had information in a variety of languages to meet need, and that's really, in terms of our action plan, kind of where we've got to. But that was a real big win, because the people that came through the doors to have the vaccinations on those occasions are people that probably, without having the opportunity to be able to ask those questions in a trusted place, they probably wouldn't have had the vaccination otherwise.
Thank you. Jazz, your thoughts?
In 2019, we were asked to extend our daycare provision to Asian older people when their daycare centre closed. And that's what we did. We started from scratch, meeting with those older people, asking them what they needed, what their needs were, how they wanted the service to be delivered. And then we developed a service. So we now have an Asian and African Caribbean daycare service.
Thank you. Jazz, Sanchi, is there any other questions coming through?
Yeah, sorry, I just accidentally launched a poll. Well, I didn't do it by accident, but I wanted to find out what people thought. So if that's changed your screen for people, apologies. We'll close it again in a second. Yes, well, one suggestion, I don't know what people think about this, is that because there are so many questions, perhaps we should hold a webinar that is just question and answers. I don't know what people feel about that.
Fine by me.
That's a good idea.
Yeah.
Right, I'm going back to, there's a lot about personalisation and person-centred planning. It's important for care organisations to actively recruit staff from ethnic minority backgrounds, so it reflects wider community demographic and understanding cultural differences. I think that's just a comment. I'm just looking down the questions. How can the church community be proactive to engage with supporting ethnic minority community who have vulnerable adults and need safeguarding? That's a good question.
Okay. Nichola, your thoughts on that question?
So as you can see, I've got the sun blaring through my eyes, so my apologies. So I hope you can see me. I can't see me, but that's okay. Yes, so we do a lot of work with the faith-based community within Hackney. We do a lot of stuff on what is mental health. We're very much about challenging the stigma and the discrimination that's experienced within our own communities. We're very much about creating positive mental health within the community. So what we do, we go around to the various church organisations. We also This Gal Can group, which is for women 16 plus, is around self-esteem. That's actually in partnership with one of the local Methodist churches. And it's really about kind of showing people and teaching people about, well, what is a safeguarding issue? What does abuse look like, and how to report those things, but also how to ensure that your congregations, your places of faith are actually protected. And so really my thing is just that, once again, it's about being that conduit. It's about getting in the community and finding out what those needs are and making sure that, I hate using the word educated, but it is about sharing those education, just making sure that people are aware of it. But many of our churches actually do have safeguarding bodies. But what I do think the challenge is around, what does that mean for the church? And I say to people, I think, if the church is held accountable and responsible for what happens in the church, actually that's not a bad thing. It's more bad if you kind of turn a blind eye to it. So we are really much about going into our communities and making sure that they do the right thing at the right time. So we do that quite regularly. We do that in the Christian community and also within the Muslim communities.
Thanks, Nicola. Jazz, your thoughts?
I agree with Nicola. Most of the mainstream churches do have safeguarding bodies. They do have safeguarding responsibilities. And I think they're also a lot more proactive than a lot of us may know, particularly even before COVID. So I think it's more about understanding the work of local churches, what they are doing in the community. And, as Nicola's given the example of how we then create partnerships to extend that work or to support it.
Thank you very much for that. Tash, your thoughts?
You put yourself
Can't hear
on
you.
mute, Tash.
Can't hear you.
Okay, shall
Okay.
we move on to the last question, because we've just got a couple of minutes left, and then maybe ask people to make any closing comments. I'm going to go right back to one of the questions that came in at the beginning, which was, do mainstream statutory advocacy services meet the needs of the people we support?
I'd give that question to David. Let David.
Simple, isn't it? No. And we know no because really national research has shown this for some time. I think that one of the important things to recognise is that at the individual level, individual leaders within statutory organisations or individual services do often offer exceptionally good work with minority communities, but it shouldn't be down to those individuals. It needs to be about the way in which statutory organisations work and think about being services for a diverse community, not one particular community plus another few awkward ones. And I think this is, again, something that goes to the challenge for all mainstream communities now, is how do they work with the diverse communities that they are pledged to serve and are statutorily required to serve. There isn't enough, and it can't be left down to the goodwill of individual good practitioners. It must be established at a policy level as part of the mandate. And what we're seeing here today, and we can see in the report, is the many ways in which that can work. There isn't one size fits all. There are 1,000 different sizes for a million different and more people. So I think the sooner that we all get on with addressing the opportunities and working to develop some of the good practice we can see being talked about here, the better. Let's put an end to simply restating the problem. There's been a lot of that in the COVID period, restating the problem that services are provided inequitably for minority communities. Let's all step up and start providing services that are appropriate and adequate and valued, as we can see from some of the services being talked about today and the further services that are in the report.
Thank you for that, David. Our time is really coming to an end, and I'd like to thank all our speakers again, and thank you for being such great sharing of knowledge and information. But also, I'd like to thank our audience for the questions they put forward. But I'd also like to, I think this is a good start in trying to close the gap. And if you haven't already done so, please do read the report that this webinar is based on. And also, please do sign up to the Think Local at Personal newsletter. But also, before we close, I just wanted to remind people that the government has published its white paper yesterday and its 10-year vision to improve adult social care. And if you're interested, you can see the response on the TLAP website. So, and all information on the TLAP website is there for people to have a look at. But I'd like to just say to everyone, thank you and goodbye.
Thank you.
And panelists, file, exit, leave webinar. File, exit, leave webinar.
Thank you.
If you don't have that one, Helen, you might just have to click the X in the box. Right, are you able to do that?